Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab. All on your time, live or on demand. This is CSIS Online.
Hello, and good morning, evening, afternoon, depending on where you are. I'm J. Stephen Morrison, Senior Vice President at the Center for Strategic and International Studies here in Washington, D.C., and we're delighted to welcome you to today's event, Lessons from Dreams and the Road Ahead for U.S. Policy. I'll say a bit about that in a moment. I want to first thank many of the people who made this all possible, including the report, which I'll talk about in just a minute. There are many people from the staff here at CSIS who have contributed significantly to the production of the report and the organization of this event. I want to single out in particular Michael Rendelman, Mary Wright, who's helping produce this today, Mark Donaldson, Liz Richardson, Catherine Stark. This report comes with companions of 10 videos and podcasts. Great innovation, great innovative work that's brought the voices of many of the young women and adolescent girls who are the central focus of this work. On December 1st, 2014, World AIDS Day, PEPFAR sounded the alarm on HIV infections in adolescent girls and young women and launched a bold initiative called DREAMS, Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe. The goal was to significantly reduce HIV incidence among girls and young women in the highest burden countries in sub-Saharan Africa and in Haiti, where they face a far higher risk for new HIV infections than their male peers. DREAMS is COVID-19 and new global efforts around health security threatens to divert the focus today. DREAMS is now at an inflection point, facing the risk that its progress on girls and young women may be reversed, along with decades of health and developmental gains for women and girls under the pressure of SARS-CoV-2. We've just released a major new report, 5 Years of Dreams and What Lies Ahead, How to Address the Intersecting Crises of HIV, Gender Inequality, and Health Security, which examines what lessons have been learned in the first 5 years of DREAMS and what the next 5-year approach might be, including redressing the disruptions and costly damage imposed by COVID-19. We'll be hearing from the author and researcher of that report, Janet Fleishman, senior fellow here at CSIS. I simply want to say, in the many years that Janet has worked with us, she has really made startling contributions to the work of CSIS. She brings incredible commitment and talent and gifts to this task. And you'll see that in this report. I don't think there is any other report of this quality and depth on this such an important topic. And congratulations to her. But we're also very grateful for the innovations and the quality that's come forward here today. The report discusses implications for U.S. policy, what is needed going forward if DREAMS is to further drive down HIV infections and increase the health and agency of girls and young women, more broadly with recommendations for the new Biden-Harris administration and Congress. There's no question that a window has opened due to the global COVID-19 pandemic and the advent of the Biden administration to ask how we can achieve better results from integrated, coordinated approaches. Despite its challenges, DREAMS has proven to be a promising model that is uniquely suited to an adapted and reimagined U.S. strategy that moves toward more integrated approaches and away from siloed vertical programs. We have a remarkable lineup of speakers today. Janet will introduce them and thank them. We have people who have been there since the very beginning, since the creation of this remarkable effort. I want to thank all of them in advance, and I want to thank Vive for the generous support and guidance they've provided us in this project. We wouldn't have been able to do it without the contributions, the intellectual contributions from all of those who we'll hear from today, and from the support and guidance that we've received from Vive. So thank you all for joining us. Time's tight. We're going to have to move forward briskly to hear from everyone. Over to Janet.
Thank you, Steve, so much for your leadership and support of this work on adolescent girls and young women for so many years. I also want to thank the many adolescent girls and young women, experts, implementers, representatives of civil society and national governments, multilateral organizations, and US government agencies who shared their insights and experience and provided input for us during this process. This is a critical moment to be addressing the intersecting crises of HIV, COVID-19, and gender inequality, and the disproportionate impact on adolescent girls and young women, especially in the high-burden countries of East and Southern Africa. Given our inability to travel to the DREAMS countries due to the COVID crisis, we wanted to find new ways to bring the voices of women and girls and others from the DREAMS countries to a broader audience. So as Steve said, through a series of podcasts and videos, we were able to present the current on-the-ground realities and perspectives about the urgency of addressing the needs of adolescent girls and young women to this broader audience, including policymakers who are grappling with how to respond to these pandemics and crises. So we're excited to share with you now our final video in this series, focused on the need for global and national leaders to step up and prioritize the health and development needs of adolescent girls and young women in policy and in funding, including HIV, gender-based violence, access to education, sexual and reproductive health, and economic empowerment. This video highlights the urgency of addressing these challenges through three powerful voices: Mrs. Monica Genkos, the First Lady of the Republic of Namibia, Dr. Natalia Kanem, the Executive Director of UNFPA, and Vilepi Banda, a 17-year-old DREAMS ambassador from Lusaka, Zambia. Let's roll the video.
Imagine being a young African woman right now. You have no foreseeable prospect to be vaccinated against COVID. You are at higher risk of violence in general and sexual violence in particular. You have reduced access to sexual and reproductive health services. You have a higher likelihood of falling pregnant and contracting HIV. And you deal with all of this, knowing that your needs have never been prioritized and are unlikely to be prioritized anytime soon. This is both dehumanizing and disempowering. And this is the place where so many adolescent girls and young women find themselves. And this is why we need to redouble our efforts to spotlight issues which impact and undermine the ability for girls to become educated and empowered.
When we think about the contributions that adolescent girls and young women are going to make over their lifetimes, not just economically, but in terms of that social fabric, which is what gives life meaning. She needs to have her needs put at the center. And the sad reality is that one cannot separate a woman's experience of sexual and reproductive health from any other part of her life. I think as public health professionals in particular, we do have to get better at measuring the consequences of inaction, the positive aspects of prevention, and more than anything, we also have to allow communities to declare what they want and follow their lead. Share our resources with women and girls groups on the ground, and much more than listen, invite them to not just sit at the table, but to take the head of the table.
The message that I would actually just send to the government of Zambia is that once you educate a woman, you educate a nation. And that's just one thing that we cannot run away from. There is actually a member saying, we say, imitu ikula empanga. It means the trees of today are actually the forests of tomorrow. How do you think you're going to train a tree to become a forest if you do not provide it with the necessary nutrients? And that is why I'm saying that it would be better if they put more effort in educating a child and encouraging such programs like DREAMS to carry on, because DREAMS is doing its part, and let them do their part as well, because they want to ensure a generation that's going to be knowledgeable. And also, referring to the Women's Day celebration, the slogan was, choose to challenge. Choose to challenge. I choose to challenge.
there's no time left. We can't keep talking about the same things, but the same things keep happening. So we do need a generation of adolescent girls and young women who are supported by those of us who believe in it, to take the microphone and speak with their own voices, speak to their own issues, and do whatever they have to do to further this conversation and to see it in policy and funding priorities. Nobody can do this for you. Now is the time for global leaders to step up. This is the time for national leaders to shape up or ship out. Adolescent girls and young women can afford nothing else.
I hope you enjoyed that video. And now we're going to move to the next part of this program. As we mentioned, this project has been made possible by the support of ViV Healthcare. ViV is part of the DREAMS public-private partnership. And we are delighted to be joined now by Kathy Ferrier, Head of Positive Action Global at ViV Healthcare, who leads the team delivering strategic partnerships and grants and donations to community organizations supporting people living with or at risk of HIV. Kathy is also the chair of Circle NGO, founded by Annie Lennox, which works to tackle gender inequality and provide support for disempowered women and girls across the world. So Kathy is going to say a few words about why ViV supported this project, linked to its focus on adolescent girls and young women and empowering local communities. Kathy, over to you.
Thanks very much, Janet. That's very kind. And thank you very much for inviting me to participate in this important launch event. So ViV Healthcare has been very happy to support the development of this really important evaluation and assessment of the DREAMS partnership. We're committed to ending the HIV epidemic, and we all know that the goal of an AIDS-free generation will be impossible to achieve if women and girls are not a central focus to all our efforts in the HIV response. So given the scale and the reach of the DREAMS partnership, Positive Action was keen to support this community-focused research, talking directly with adolescent girls and young women to understand the DREAMS partnership legacy and the emerging implications of COVID-19 on the HIV response. The disproportionate impact of HIV and women and girls is glaringly evident in sub-Saharan Africa, with 5,500 adolescent girls and young women between 15 and 24 years old becoming infected with HIV every week. What has been transformative in the DREAMS partnership was the holistic approach to the needs of women and girls that aims to address their multifaceted vulnerabilities and the deep inequalities that continue to impact their health and well-being. Poverty, lack of access to education, as well as the increasing prevalence of gender-based violence, all play their part in the alarming statistics outlined in the report. A staggering 40% of women in the DREAMS countries have experienced ongoing sexual violence in the last 12 months. And the number of girls unable to access secondary education is unacceptable and getting worse during and after the pandemic. They're the first to leave education, and they're always the last to be able to return to the classroom. This report is extremely timely and pertinent with increasing global health insecurity. It's vital that investment is focused in areas of most need and on strong evidence-based interventions. And ViV Healthcare remains committed to working in partnership with communities and with the public sector to reach vulnerable young women with the support that they need. As we've seen, the challenges faced by women and girls are many and varied, and therefore the response, if it is to be effective, has to come from multisectoral groups and must be brought together in strong coalitions where both private and public sector work together with shared goals and shared targets. CSIS's research underscores how the COVID-19 pandemic is eroding what ground has been gained in 5 years of the DREAMS partnership, and the many achievements are now under threat. The COVID pandemic has had a major impact on delivering a comprehensive approach to prevention and treatment of HIV, not only the public health aspect, but the impact on social and economic shocks. There's a real urgent need to mitigate the impact of COVID-19 on the health and the wider development outcomes for women and girls. Positive Action strongly supports expanding the resources towards adolescent girls and young women affected by HIV, and PEPFAR's continued efforts in addressing the HIV epidemic among this key population. We hope this report will provide insight and direction in the coming years to the new administration to redouble their efforts and maintain a clear focus on adolescent girls and young women. We need to continue to work in partnership with communities and deliver new prevention strategies and better treatment options that meet the needs of young women and girls, and through the HIV response, contribute to tackling the huge inequalities facing them. As with the video we've just seen, we've been so impressed with the media-rich content that CSIS has created whilst developing this report, and it clearly demonstrates the value of the DREAMS partnership to millions of girls and women. And whilst we work on what comes next, we mustn't lose the achievements and gains made by the many community organisations working with vulnerable women and girls under the DREAMS initiative. ViiV Healthcare and Positive Action remain committed partners and look forward to continued collaboration. I'd just like to thank Janet and all those who've contributed to this amazing body of work from the whole team at Positive Action and ViiV Healthcare. Thanks.
I have the pleasure here to introduce Ambassador Debra Burks, who it was her pioneering work which brought DREAMS forward 7 years ago. She served from 2014 until very recently as the head of the Office of the Global AIDS Coordinator, as the director of PEPFAR. And in that period, this was one of her signature initiatives. Obviously, she also took time out starting in March of last year to assist in the response on the pandemic. So she brings enormous depth of experience with both the HIV effort, which has been the centerpiece of her career over several decades, incredible longevity of commitment as a researcher, as a leader, as a thinker, as a program coordinator of the biggest effort globally by the United States, President's Emergency Plan for AIDS Relief, but also in struggling with our current SARS-CoV-2 pandemic. So Debra, thank you for making the time. Thank you for your leadership. We'd love to hear from you.
Thank you. It's a real pleasure. And thank you, Steve, for that kind introduction. And thank you, Janet, for the report. The report is wonderful, but it doesn't truly represent everything CSIS and Janet has done for us and DREAMS through the last 5 years, and really working in partnership like the Population Council did, sponsored by the Gates Foundation, to really look at all aspects of the program and constantly be in dialogue with us, traveling to countries and really seeing the on-the-ground work and bringing issues directly back to us. I want to just take 30 seconds to thank a very small but incredibly mighty team at the State Department in the PEPFAR program, led by Janet Saul, including Carolyn Clooney, Tata Beeman, and Noya Toiv. These 4 women made DREAMS their priority. Every day they were calling countries, no matter it was COVID or before COVID or during COVID or in the current situation in which we find ourselves. They were concerned about every DREAMS beneficiary, no matter where they were. They went on the ground all the time to really find out what was working, but most importantly, to talk to the DREAMS girls and young women themselves. They were our center, they were our anchor, and this program means nothing without having constantly adapted and adopted changes in the program because of what we learned on the ground. A big thank you to Iram Sadie and the Prime Data team, who have been analyzing the DREAMS data continuously to see where we were doing well and where we needed to do better. really continuing to use data to drive decision-making. And to our private sector partners, thank you. Gilead, ViiV, Johnson & Johnson, the Bill and Melinda Gates Foundation, and Pop Council who worked with them, and Girl Effects. Really grateful for your insights. Really the sponsoring of Dreams ambassadors, the development of Dreams leaders from their peers throughout sub-Saharan Africa is an extraordinary breakthrough and reinforces what we have always said is peer-led interventions are the most effective. And it's really important for us to constantly remember that. But let us remember that Dreams was driven out of a very specific need. PEPFAR had been functioning for almost 11 years. We had invested substantially in prevention to young men, utilizing voluntary medical male circumcision and frankly, condoms, male condoms and female condoms, which were often very difficult for young women to negotiate. Our women's investment in prevention was really primarily prevention to mother to child transmission, with us almost forgetting that those HIV negative babies grew up to be 12 and 14-year-olds in those times that had elapsed since the beginning of PEPFAR. And what were we doing to address their unique needs? What kind of investments were we making in putting young women, girls and young women at the very center? As Steve noticed and noted in the opening, young women were an extraordinarily high risk. Yet that science and that data did not translate into action before this investment in Dreams. What Dreams has done, I firmly believe, is it recognizes that extraordinary data-driven gap. It is a response to that gap, and it brings together all of the science to really create a comprehensive program very much addressed in what UNFPA just discussed, putting the young woman at the center and recognizing the need, as expressed by the First Lady of Namibia, a comprehensive program that sees a young woman and a girl for exactly what her risks are that she encounters every day. They were enormous in 2014 when this Dreams program was announced. They are greater today because of COVID-19. So when we give voice to the progress we have made of putting young women at the center, and you will hear even more from our Dreams leaders on the ground, and I want to thank each and every one of them, but I want to thank our Dreams beneficiaries and Dreams leaders who met with me literally 3.5 months before COVID dramatically took off. We were all in Rwanda for ICASA, and we were in a crowded room, all of us together, listening to 20 to 25 of our Dreams leaders really telling me what we needed to do and how we needed to bridge even further that gap between the Dreams programs and really empowered young women leaders, the educational needs that they had and the entrepreneurial needs that they need for clear employment. And so we knew we had to even broaden the partnership further. I want to thank the groups that have really brought PrEP to Dreams. That is our biomedical intervention that women and young women can specifically hold and negotiate. It transcends condoms and female condoms and male medical circumcision and says, women, you are important to us. Dreams is about a partnership. And I think what the report really lays out is that we had already started stronger partnerships with Girls Not Brides, understanding that a young woman who fell pregnant at 15 and 16 was no longer attending schools and was then married was at extraordinarily high vulnerability and risk, and really encouraging, as was discussed by our young Zambians, we need a program where it's governments working in deep partnership to ensure that every young woman is in school and completes all of her secondary education and has access to employment. Because Dreams is not only about a deep dive into what was working and what's not working, but it's a listening to the young women about what they need for leadership and empowerment. I wanted to just conclude because I want to be able to get to the panel. Dreams is also about laws and policies. It's about listening to young women about their unique situation. And now, as we've been confronted and it's clearly acknowledged throughout the globe, the brunt of COVID-19 really fell to women, young women and girls around the world. Now is not the time to be decreasing DREAMS funding. Over the last 2 years, we were doubling DREAMS funding because of its efficacy. Yes, it was effective. The number of young women who are becoming HIV positives have dropped about 40% or more. That's important. But what's more important is for us to have a renewed emphasis on ensuring that young women have the access to the services that they need with removal of structural barriers. In Malawi, we had to put services 100 yards down the road from the school because they couldn't be integrated into the school system, making it harder for young women and girls to access the information and the healthcare services that they really need. So as we move forward together, let's continue to work on the laws and policies that young women need, but let's not just talk about the data. Let's take the solutions we have and invest in them and invest in those partnerships that ensure that young women not only succeed, but thrive in their countries, as we just heard, that they become the tallest tree in that forest because of the work that we did together in deep partnership. So Janet, thank you again for the work that you did all through these 5 years and really holding us accountable, because that's what is terribly important. And in all of our health programs, please, if you're providing services to women, measure them, demonstrate their impact, see what you're missing, and constantly be improving your program based on the needs of the people we serve. Thank you.
Thank you, Ambassador. We do have a couple of minutes for a couple of quick questions for you. I want to ask you, you've answered this in part. In the next 5-year period, what needs to be done differently? What are the critical gaps we need to really be prioritizing, and how are we going to proceed differently? We're not stuck in the patterns of the past. We have the latitude to make changes in course and to adapt. What's your perspective on that? Just in a quick minute on what needs to change. What do we need to do differently?
First and foremost, anybody who is spending money on education in any country, please immediately go into those schools, go into those communities and see if those numbers are true. How many young women are dropping out of school? That's going to be regional, it's going to be geographically specific, and we need to change that. We need to make that a crisis, and we need to invest in that. So that importance of education is absolutely core, but bridge to employment is just as important. And I think Janet and her team of those 4 incredible young women at SCAC work every day on trying to really create that bridge to employment. I think we can get the bridge to education and completion of education, because that empowers a young woman to not fall pregnant early and marry early. But we need a full bridge to employment so that countries can realize the strength and power and brilliance of the young women that we get to work with every day.
Thank you. One other question, and then we'll go back to Janet and we'll move forward on the program. We're now in a period where we're living with the HIV pandemic, and we're living likely with an endemic SARS-CoV-2 that's still to be worked out and determined, but we're going into a future that's much different in terms of health security. It's much different in terms of integration of effort. People are wrapping their minds around this. In your view, what type of coalition is going to be needed? What kind of widened coalition is going to be needed looking ahead in order to sustain dreams, but put it into this larger context?
Well, first and foremost, what we built together between the Global Fund, the President's Malaria Initiative, and PEPFAR built health systems that sustained the COVID-19 response. I'm incredibly proud of that, because until it was tested, until we saw that the healthcare personnel that we had trained, the laboratories that we had built, the clinics that we had refurbished, all of that equipment that we put in countries and purchased for HIV and TB, the Cepheid platforms, the Roche platforms, the Abbott platforms, they held and they became the platforms for diagnosis of COVID-19. So if we ever needed an illustration of how these vertical programs created a resilient and sustainable health system that could respond in pandemics, we showed that. So to me, the question is, how do we continue to invest in these vertical programs that show that they had the horizontal impact that we expected? Not every country, and we got to deep dive into that. But we need to be asking ourselves how to end these 3 pandemics that we put in a priority, because in the end, over time, they have killed way more, but every year, many people die from HIV, TB, and malaria. So we have that work to finish while we grow this essential work and this horizontal recognition that if women and young women don't have opportunities and thrive, we are lost as nations. And I think that's where we ought to really be talking about integration, because when we see the shocks from this, yes, the health system sustained and responded, and our PEPFAR people pivoted to COVID. But what didn't happen is the economics of all of this are impacting differentially our young women. And if anything, we should be focusing all of our effort in creating a horizontal, sustainable, resilient program that puts young women at the center.
Thank you so much, Ambassador Burks, and thank you for your leadership and your vision on this. And thanks and congratulations to your entire team, as you've referenced. We'll be hearing from Janet Saul momentarily. I'm going to hand off back to Janet so we can move to the next. We're actually on time, coming in a little early. Over to you, Janet.
Thank you, Steve. Thank you, Ambassador Burks. We're happy to be a little bit early because we have a very exciting panel that we're going to turn to now. I'm delighted to be joined by such a stellar group of champions for adolescent girls and young women from Kenya, Zambia, South Africa, as well as the US. We have featured many of these people in our podcasts and videos over the past 10 months. So check them out. And they've been enormously generous in sharing their insights and contacts with us and helping us move forward with this project. I've asked each of them to speak very briefly so that we're able to have a panel discussion afterwards. But I'm going to run through and introduce each of them, and then we'll hear from them in turn and then have a bit of a discussion. We're going to begin with Daniel Oliok-Madiang, who is the Senior Technical Advisor on Adolescent Girls and Young Women for PATH in Kenya, and a 2020 PEPFAR Hero Awardee. He is an HIV and sexual and reproductive health practitioner and social and behavior change communications expert with over 20 years experience in designing and implementing health programs for populations in Eastern and Southern Africa. Next, we'll hear from Misozi Siwela, the Senior Dreams Manager for PACT in Zambia. Misozi has previously worked for the Pop Council in Zambia and has 9 years experience working with adolescent girls and young women, and of course has been extremely helpful to us during this project. After Misozi, we're delighted to hear from Grace Nachila, a Dreams Ambassador in Zambia. She holds a certificate in general hospitality and catering. And in addition to her role as a Dreams Ambassador, she was appointed as a mental health ambassador by a group called Strong Minds, an organization providing mental health support to Dreams girls in Zambia. Then we are delighted to be joined by someone known to many of you, Professor Linda Gail Becker, the director of the Desmond Tutu HIV Center at the University of Cape Town. She is a physician scientist and infectious disease specialist and past president of the International and finally, we will be joined by Janet Saul, who is the Director of Programs, the Gender Program Director for PEPFAR at the Office of the Global AIDS Coordinator. And she will provide her reflections on the report and about some of the issues that the other panelists have addressed. So let me begin by turning over to Daniel to begin with his presentation. Daniel, over to you.
Thank you very much, Janet. My name is Daniel Oluoch Madiang. I'm a senior technical advisor at PATH. And I am delighted and would like to begin by thanking and congratulating Janet and the CSIS for coming out with this report that basically captures some of the lessons, experiences that we have gone through in the past 6 years as we support our young women to prevent new infections and reduce violence that they do undergo. I would also like at this juncture to really acknowledge and appreciate the support of the US government in enabling us to support and implement this comprehensive prevention program, which I should say has been able to really build the capacities of young women to prevent new infections. I would like to aver that this report, in fact, does contain some of the observations and lessons that we have learned, and the fact that we have made some progress with regards to the way in which we reach out to our vulnerable adolescent girls and young women, compared to those circumstances where we did vertical interventions. This multisectoral comprehensive program has helped us achieve and gain quite some lessons. And I can share, for example, that we have observed increased service uptake by our girls because of the accessibility that is created by the safe space model that basically gives girls the opportunity to access the services and also to interact with service providers in a manner that is youth-friendly to themselves. Here in Kenya, we are happy that we have seen an integration of HIV and SRH in our safe spaces. And this increase in access of such kind of services does in fact lead to some outcomes on HIV prevention that we are absolutely happy about. We struggled sometimes with gender-based violence, and we learned very early on that our younger women did sometimes tolerate violence so that they may be able to access economic support. Yet within DREAMS, we have learned that increasing young women's access and control of economic means empowers them to be able to stand up against violence, and knowing that violence is one of the factors that increases chances of new HIV infection, we are seeing linkages between economic support and working with multiple partners so that we may be able to reduce violence and in the end, reduce new HIV infections. Everyone has experienced the COVID-19 pandemic, and true, it did affect our implementation. And some of our scary moments were the extent to which our girls would miss access and taking up of critical HIV prevention services. We have worked with this pandemic to create new innovations. And we've learned from COVID-19 that we can further differentiate service provision to our AGYW and put up innovations like home delivery of services, utilization of virtual safe spaces, working with our peer girls to reach out to their respective girls, and at the same time, ensuring that we are contributing to COVID-19 prevention knowledge at the same time as we are mainstreaming HIV and SRH prevention. Going forward, there are opportunities that we can probably tag on. This is a multisectoral approach to programming. Our governments do run policy, do create policy, and do sometimes work with budgets in a manner that we need to see the extent to which these are utilized to promote girls' health. How can we work to ensure that policies, for example, in Kenya on subsidy of secondary education, youth fund, women's fund, universal health care. These particular government approaches, how do we help the policymakers to see that AGYW are a critical audience that need to be given a particular focus to access this very well? Finally, we have implemented DREAMS for over 5 years. Within those 5 years, we have had adolescent girls and young women who are graduates of this program. They have experienced it, they know how it runs, they know its strengths and weaknesses. I see in these graduated adolescent girls and young women a pool that we can work with so that we may be able to expand HIV prevention programming to more adolescent girls and young women using the experiences, the expertise, and the vision of those who have gone through the project. So thank you very much. Those are my brief remarks in this. And I think that this report will be absolutely useful as we look forward to the 5 years ahead. Thank you, and over to you, Janet.
Thank you, Daniel. And now we're going to turn to Misozi to hear some perspective of the innovations in Zambia and some of the challenges that they have faced. Over to you, Misozi.
Thanks, Janet, and good afternoon, everyone. So when Janet asked me to speak about and reflect on the past 5 years of implementing DREAMS within 3 minutes, I thought it was a very difficult request because there's just so much to talk about. I've been on the project since inception in 2016, and the report, as my colleague Daniel has mentioned, is really a powerful tool to use to just reflect and talk about some of the recommendations throughout the experience implementing DREAMS. So as I've mentioned, there are a lot of areas to touch on, but I think today I'll reflect on one of the recommendations that's talking about decentralization of services. So DREAMS in Zambia is providing services through DREAM centers, which are in form of a drop-in center. So initially when the centers were established, the focus was on providing biomedical services with the specific services like HIV testing, family planning, and condom distribution. So looking over the years, other high impact services such as PrEP and HIV self-testing are available at the DREAM centers. So we have reached over 600,000 girls and young women who over a period of 5 years have constantly been coming to the DREAM centers in need of these services. So when we talk about innovation, I'd like to talk about the fact that we can use spaces such as DREAM centers to integrate other SRH services, as well as economic strengthening interventions that Grace will speak to, such as girls learning different skills at the DREAM centers. My colleague spoke about the impact of COVID and innovation. So we trained the girls in the DREAM centers to sew face masks, of which they've made cumulatively an income of $7,000, and we've been able to document some of the uses that they had with money in these critical times. So you have a space where not only are you providing these biomedical services, but it's also a safe space for the girls to walk into just to simply interact with a psychosocial counselor, to interact with the nurses that are present at the centers twice a week, but as well as also to build social networks. Skills development is another innovation that has really become a huge part of the DREAMS program in Zambia. As we speak, we have girls and young women in the various DREAM centers learning how to use computers. And so far, they've been able to use these skills to apply for jobs. I think Ambassador Burks was talking about bridge to employment. And just recently, we're interacting with some of the girls who've actually gotten secretarial jobs based on some of these skills offered at the centers. So I think we can still do a lot more. There are 59 DREAM centers in the country. So it means there are a lot of communities that are still untouched. The centers are also strategically located in high HIV-burdened communities. So when you look at, in terms of strategy and really placing these centers at the heart of the communities, most of the challenges we used to hear years ago about girls having to walk long distance to get to the facility, or maybe not being served or being stigmatized by healthcare providers, these are some of the lessons that we've learned that when you have community structures and you bring them closer to the girls and young women, the uptake of services is actually very high. So this also links to another recommendation on cost effectiveness. I think there's need to reflect on the service package, to look at what's scalable, how we can involve different government ministries. For example, in Zambia, we're working very closely with Ministry of Health, but we have Ministry of Gender, Ministry of Community Development and Social Services that could take ownership of programs like Dreams to enable us to scale them out to communities that are not yet reached. So I think in a nutshell, that's what I'll share for now. I know we will have an opportunity to engage in some Q&A, but I thought I should focus more on these important platforms. And I was really excited to see that it came out as one of the recommendations. Thank you.
Thank you, Ms. Osi. And now let's turn to Grace. We are so thrilled to be able to be joined by one of the Dreams ambassadors. And this is an extraordinary example of the leadership and the agency and the lessons we have to learn from the young women on the ground. So over to you, Grace.
Thank you so very much and good afternoon. My name is Grace Nachila and I'm a Dreams ambassador. I'll just share a bit of my story. So I'm a survivor of gender-based violence. I was sexually abused by my uncle on different occasions from the age of 6 until I was 10 years old. And he later infected me with sexual transmitted infections, which left me traumatized. I was a lonely girl. I used to isolate myself most of the times. And later when I was 17 years old, I got married to a man who was 30 years old, thinking my life would change, thinking I'll go back to school, but not knowing that I'll find more problems. I was being abused. I was mentally abused. I was physically abused, emotionally abused. And 4 years later, I decided to leave the marriage because of the abuse. And when I went back to my family, the community mocked me, my family mocked me, and I was so depressed. I just wanted to kill myself. The only option I had was to commit suicide. Maybe I kill my child and kill myself. And luckily, I was introduced to Dreams by the mentors, and I was enrolled in the safe spaces, and I graduated. After graduating, I received the services such as HIV testing and counseling. I received family planning, and I used to frequent the center where I'd go and make reusable pads, which we call the COSO, where we make reusable pads, make handbags, make purses, etc., etc. And then I was also introduced to a computer literacy program where after I completed the program, I was engaged as a community mobilizer for the Ending AIDS campaign. And then later I was given an opportunity to go to school under the Dreams project, where under vocational training, where I went to school, and I'm proudly a chef now. And where I was also empowered with a popcorn machine to help myself sell a little and also help me and my family. And also I'm now a Dreams ambassador where we plan activities as Dreams ambassadors. And this is one of the important thing to engage young people in decision making, to engage young people in such programs, because now we're able to plan activities, and we know what as young people what affects us, and we also know what services that we need. So it's so important to engage young people in decision making and also planning. And finally, I would just want to say thank you to the Dreams program for making me or for empowering me and being a woman that I am today, young woman that I am today, standing up for other girls, standing up for other young women in my community. And now I'm a proud ambassador.
Thank you so much, Grace. I know I'm going to turn back to you in the Q&A about what more we can do to better listen to and engage adolescent girls and young women to improve the programming. I'm going to turn now to Linda Gail Becker. Linda Gail, over to you.
Thanks, Janet. As has already been said, almost 1,000 young women and girls became infected with HIV this very day. 1,000 young women who will carry this burden for the rest of their lives and may in turn have to worry about the well-being of their offspring. Many more became pregnant and dropped out of school, despite having very different dreams and ideals. Many became victims of gender-based violence. Yet these same young women we will rely on and depend upon to become the cornerstones of our communities. My deep thanks goes to Janet, Steve, and CSIS for a frank and incisive report on the last 5 years of the DREAMS project. But most especially, I want to thank Ambassador Burks, the DREAMS team, Janet, and PEPFAR for the DREAMS project. DREAMS, in my opinion, is the boldest program yet to try to answer this critical challenge. Multisectoral, decentralized, layered, girl-centered, scaled up, and evidence-based, this approach is unique, welcome, and impactful. The report refers to an inflection in time. I would say not only a critical, but also a rapidly closing window of an opportunity to build on the momentum of DREAMS. As we reflect on the 5 years of DREAMS, with the crashing impact of COVID in 2020, we need to urgently decide on our collective next steps on this very continent. We need to take stock on how the last 2 years have set us back and to redouble our efforts to take the lessons from DREAMS forward urgently. We will not see the control of the 4-decade-long AIDS epidemic without dealing with this important challenge. COVID has thrown this fact into even sharper focus for each one of us. I absolutely echo the First Lady, Madam Gangos from Namibia. There simply is no time left. Thanks, Janet.
Thank you, Linda Gail, and for all your help and insights along the way. I'm going to turn now to the other Janet, Janet Saul, the Director of Gender Programming for PEPFAR, who, as Ambassador Burks said, has been involved in making DREAMS a reality since the inception. So over to you, Janet.
Well, thanks so much, Janet, for this report and for bringing all of us together today. We really appreciate your constant advocacy for AGYW. I, of course, have to take a moment to thank Ambassador Burks for insisting those few years ago that PEPFAR needed to invest in HIV prevention for AGYW. Without your vision, I really believe we wouldn't be having this conversation today. I want to also recognize Grace and all of the other DREAMS beneficiaries who overcome great barriers to take part in DREAMS. And Grace, you said that DREAMS empowered you, but what I want to say is we gave you some tools and you empowered yourself. So thank you for picking up those tools and running with them. Janet, I'm so glad you emphasized AGYW involvement in your report, and I couldn't agree with you more. Our countries are currently hiring AGYW as DREAMS, as district level coordinators for DREAMS, where they will have daily input into DREAMS implementation. You also suggest that AGYW should be involved in monitoring DREAMS. I think that's a great idea. With PEPFAR's emphasis on community-led monitoring, we can create a role for AGYW to monitor not only DREAMS, but other HIV services. You also made recommendations that the provision of clinical services should be decentralized and that HIV and SRH services should be integrated. And we heard some examples of that from Daniel. HIV prevention is sexual and reproductive health, and so they absolutely should not be siloed. Since the beginning, DREAMS has delivered clinical services in both facilities and in communities. So we support both of these models. COVID-19 has definitely accelerated community delivery. We've heard over the years from AGYW that above all, they desire accessible services that are free of stigma and judgment. So wherever the services are delivered, we need staff who are trained to do this in an adolescent-friendly manner. Training staff contributes to local capacity and also to the sustainability that you emphasize in the report. I guess I'd like to talk about what we see as the future of DREAMS. We're supporting countries to roll out newly enhanced economic strengthening. We've heard a lot about bridge to employment already on the panel, and that's critically important. AGYW have been telling us that, and we're really trying to improve that. We're also improving supports for our Dreams mentors. We will continue to emphasize PrEP, the scale up of PrEP, as well as preparing our platform for new prevention technologies as they come out, the ring and injectables. We'll also delve further into the data to look at the questions you posed about optimal packages and intermediate outcomes. This is the next frontier for Dreams. We need to ask ourselves, what is working for different outcomes with which AGYW in which settings? And how do we refine our package with an eye towards both effectiveness and sustainability? Finally, a major priority for all of us needs to be to continue to raise the alarm, to elevate the importance of prevention among AGYW. There's still a disparity between the rates of HIV for AGYW and their male counterparts. We owe it to the young women to rise to the challenges that you've raised in this report. And I look forward to discussing how we can do that together. Thank you.
Thank you, Janet, and thank you for all the work that you've done from the OGAC perspective. So let's open this up for a few minutes of discussion. And I think it's appropriate to begin with Grace, because we talk so much about how to better engage with, hear from, learn from, meet the needs of adolescent girls and young women. So Grace, what are some of the thoughts that you have to share with us and with PEPFAR about how that can be done better?
Okay, so thank you very much. So giving young girls or young women, mostly young people, a platform to discuss issues with government officials. I'll give an example where we can have, where we invited to meetings, high-profile meetings, where we discuss, because we understand our problems, we know our problems, we are the ones that are facing the problems. So if we can be given a platform where we tell the leaders ourselves to say, this is what we are going through and this is what we want. And other thing where we can also be engaged, where we can have discussion or maybe invited to meetings, or we can advise funders on what we want, the services that we want, and also discuss on different issues that are affecting us. Because like I mentioned again, we know the problems, we understand the problems, and we know what we want as young people.
Thank you, Grace. And one of the recommendations in the report that we talk about is the establishment of AGYW advisory groups in each Dreams country to begin to think about what some of those mechanisms might look like. So we will welcome your thoughts as this goes forward about how that might evolve. I wanted to turn for a second to Daniel to ask a little bit more about the SRH HIV integration and the importance of that as a critical aspect of the Dreams work you're doing in Kenya. Can you speak to some of what you see as the opportunities to do that better and the challenges you face in making those services more available and accessible to AGYW?
Thank you very kindly, Janet, for that question, and also for the contributions that have been made here. Janet Saul has said, HIV prevention is in fact SRH. And I think that then underlines what we really need to use as our guiding principle and roadmap when we go out there. If you read the report, you notice that there are some references to our AGYW not wanting to get pregnant, not as much as getting HIV. And so there is an element in which there is prioritization of what they really don't want the society, so to speak, to say. So we need to ensure that we are supporting their vision of not getting unintended, unwanted teen pregnancies, while at the same time ensuring that they are not getting HIV. our experience with PrEP introduction, the oral PrEP, was such that we noticed there was a little bit of confusion between oral PrEP and daily pill for family planning. And some of the stuff that we were having were that, oh, I can take it the way I take the pill. So that already shows you that there is a need to ensure that we are building capacities, knowledge, opportunities, access, uptake of both SRH services for our girls and also HIV services. I also do think that sometimes working in the communities, there are some cultural, religious, social perceptions with regards to provision of SRH services, so that sometimes people think it is promotion of immoral behavior. But we are seeing that they may be having quite some support in HIV prevention and reducing pregnancy amongst our girls. So already, I think that there is an environment that acknowledges that HIV is in fact sexual reproductive health. Finally, the Kenyan experience during the COVID-19 period early last year was alarm at the increase of unintended pregnancies amongst our adolescent girls and young women. And some of the avenues that folks saw as where this would have been tackled was opening up schools and ensuring that our dreams safe spaces are active and ongoing. So already I think that we need to now actualize linking both ASRH and HIV prevention as one package to our girls, and particularly in an environment where we do know that violence, gender-based violence, cuts across both issues. I think that's the point I would love to put up at this particular point. Thanks, and over, Janet.
Thanks, Daniel. Linda Gail, I wonder if I could ask you to reflect a little bit more about some of what you were saying, which really is a follow-up to Daniel's comments about why we have to do a multisectoral approach to reach adolescent girls and young women, a multisectoral approach that meets their needs, that is decentralized. You've had experience with both working with the government of South Africa, as well as the US government, as well as the multilaterals. What do you see as the opportunities and the challenges of doing this kind of multisectoral approach?
I think, Janet, to briefly sort of comment on this, I think we have to recognize a few things. The first is that we're talking about young people who are in transition. So they're finding their sexual identities, they're becoming adults, this is a normal and natural stage of development, but an important one. Secondly, where do we find them? They are not sick. They are not seeking health on a daily basis because they are healthy and vibrant and well and getting on with their daily lives. They have dreams and aspirations and very much centered on, the identity formation and reaching their futures. I think we've denied these facts when we've thought about programming for young people. But I think as we've engaged with them and we sit and we listen with them, we increasingly become aware that these facts must play into how we program them in order to reach them. So what young people tell us constantly is that they don't see themselves going to traditional health facilities in order to seek sexual reproductive health and well-being. And so, for 30 years while I've been working in this field, I've been, really frustrated by the fact that these young people constantly tell us this is not where or how they want to find their services, and yet we've tried to mold them and push them into this mold, and in a constantly not hearing sort of way. So I think what Dreams has done and what other successful programs of similar ilk have done has said, well, let's actually normalize health-seeking behavior. Let's take it out of health facilities, particularly as it relates to prevention and sexual reproductive health. And let's find ways to deliver this where people are. Now, again, we have to look, where are young people most of the time? Well, indeed, they're at school. And if they're not at school, then they're in their communities, maybe doing some chores at home. But then they're not in the workplace, unfortunately, although that's where we ultimately want to see them get to. And so again, we have to say to ourselves, where are we going to find these young people? And where are we going to find them where they want to be? And so this is where, again, I think this ability to say, we have to think of programs that do take us into the school health system. And I absolutely echo Ambassador Burks. This is the challenge of the day. And I think it's something we have to grapple with soon, and grapple with in a very real way, that what are we going to do within, with this fact that a lot of the young people we want to reach are actually in school, and they have needs that require us to go into the educational system. Secondly, what can we do outside of the traditional health facilities? And then thirdly, what can we do with our traditional health facilities to actually make them more adolescent friendly? And all of this requires us to say, probably we're going to have to move outside of the pure health sector and bring other sectors on board. And again, that is a fact we're just going to have to take on board and address. I think it's the elephant in the room. We continue to dance around it. We continue to think there must be a different way, because this is not what we want to do as the health sector. But, again, 30 years into this problem, I think this is the writings on the wall. This is the only way we really are going to make a difference to this particular population. Thanks.
Thank you, Linda Gail. Ms. Ozie, I want to turn to you for quick reflections on these challenges of sustainability. What needs to happen, do you think, when you look at working with the government of Zambia, working with the Global Fund, working with communities, transition to local partners? What do you see as the next steps that we should be thinking about and considering to make the DREAMS kinds of programs reach the scale and have the sustainability that we all hope they can?
Thanks, Janet. So I think it all starts with owning some of these programs that are on the ground. We're working in communities that have a lot of players on the ground, the civil society organizations, government, like you've mentioned, and other local organizations. So PAC, for example, has been building capacity of local organizations, 6 in total, who have been the direct implementers of of DREAMS in the different districts. So like I gave an example in my presentation, I think it's more of moving towards a direction where everybody is playing a role. So there are so many ministries that are working with the girls directly that could be supplementing the services that are not provided on DREAMS. We look at the DREAM centers, for example, and we talk about the cost of running the centers. I envision a situation where there's so many spaces in the communities that can be converted into safe spaces for these girls and young women. When you interact with a lot of girls, they also talk about the lack of recreational spaces, which end up forcing them into activities that can potentially put them at higher risk. So when you just look at really even just providing that infrastructure, that space where the girls are able to walk in, interact with community volunteers, their peers, and feel safer. I think there are many more players beyond project implementers who can come in and provide such spaces. And then this directly links to scaling up of the program. As we know, DREAMS is not in every community in Zambia, for example. So I think it's us looking at the service package and being very innovative on how we can decentralize the services, but at the same time, bring in all the key players, especially led by the government, to take ownership of these services and scale them up to other communities that are in need to reach a lot more girls than we're currently reaching on the program.
Thank you, Ms. Ozie. And that tees up Janet Saul for the final question. You talked about the next frontier for DREAMS, and part of it clearly involves this question of, can we find a minimum package of services that can be sustained and scaled and adapted to different contexts and country needs? Can you reflect for a minute on how we get there, what needs to happen from PEPFAR to adapt the program in a way that it can meet the needs of the current very challenging environment.
Sure. Thanks, Janet. Yeah, I think this is a really important question. You know, we have some data already, I think, that we need to look at. Ambassador Burks mentioned the work that we've done with Pop Council and London School on some evaluation. We've been focusing on the big picture, right? The big picture of, you know, across all of the studies, what are some of the conclusions we can make across? But I think what we really need to do right now is kind of dig down at a country level, because I think that's where the answers are going to be. I think we're going to have to dig into both those the data from those evaluations, as well as the data, our program data at the country level, because what we have hints of right now as we've looked at the data are that, you know, because DREAMS, we have this core package, but it is not implemented in the same way across the 15 countries, right? When you talk about a minimum package, in some countries, the primary package has just 3 components to it. In other countries, the primary package has 7 components, right? So it's really complicated to look at this, but I think we need to, and I think we need to start at the country level. At each one of the countries, what's in the package? What are we seeing as far as impact on these other outcomes in addition to HIV? Which pieces of that package can we get some clues? I mean, we don't have, you know, an RCT set up where we can look at, you know, many, many different combinations, but I do think we can get clues from both the evaluation data and the program data to start to triangulate it and say, you know, are there combinations of interventions that are most optimal for certain outcomes? And so I'm repeating myself now, but I think we start at the country level with those questions.
Thank you, Janet. I'm sorry that we're not in person, because we could speak for so much longer and hear from all of you in much greater depth. But unfortunately, we have to respect the time of this format. So let me just provide a few closing remarks. We've heard so much today about how DREAMS is reaching millions of girls and young women with a multisectoral package of services, and that those contributions to HIV prevention will continue to grow. We've heard that directly attributing the DREAMS impact is complicated, but DREAMS clearly has contributed to a decline in HIV incidence among AGYW in all the DREAMS districts. But DREAMS represents an expensive model that is difficult for countries to replicate and sustain, and it has sparked criticism for operating in parallel to national and local mechanisms. But DREAMS has also catalyzed a global response on AGYW, including with UNAIDS and the Global Fund to Fight AIDS, TB, and Malaria, and by some national governments. And these efforts have to continue as well. Clearly, the situation for AGYW has been vastly exacerbated by COVID, which is further straining national and donor budgets while increasing the very factors that put AGYW at risk for HIV in the first place. DREAMS also faces many challenges, including around data and evidence of what works and how, coordination with US government agencies and with host governments, engaging male partners, and addressing some of these issues of gender norms and the broader question of cost and scale and sustainability. I think it's appropriate to, while addressing the challenges and the critics, DREAMS has proven to be a very promising model that may prove to be uniquely suited to an adapted and reimagined US strategy that the Biden-Harris administration can carry forward, focusing on integrated approaches and away from siloed, purely vertical programs. We have heard that empowering and supporting girls and young women to be the healthy and empowered leaders of their communities and their countries, and to advance broader health and development outcomes for this population is a critical piece of what DREAMS has done and could be a pivotal component of a new US strategy. The challenge now is really whether DREAMS can go beyond this proof of concept and become that kind of scalable, sustainable, and transformative program that countries can then adopt and own. I think it's appropriate to cite the words of Kanye Kwacha, a PrEP ambassador whom we interviewed in one of the podcasts from South Africa. And I asked her what gives her hope. And she told me, little by little, our young girls are learning to put themselves first, learning to take control of their lives first. They are reaching out for goals, and right now they are strong about what they want in life. I'd recommend you listen to the PrEP podcast because Kanye was really powerful. We need to support these young women. We need high-level leadership that will carry this program forward, and that means in the US, administration and congressional champions, and in the country, it's national and local champions, and listening to and having the leadership of adolescent girls and young women themselves. We need to demonstrate commitment to and accelerate what has worked and acknowledge what US investments have achieved. This also means that the US will have to operate with greater multilateralism and humility, learning from communities, governments, and adolescent girls themselves, and joining with them as a supportive partner. So I want to take a moment to thank all our panelists for their leadership, for their commitment, for the power of their voices. And I want to thank all of you for participating in this event. And thank you, and I think we can conclude.